Good morning and good afternoon. Our research is focused on unraveling of exploring comorbidity between Alzheimer diseases and type 2 diabetes in the Latino population. We focus on familism and lifestyle factors. So this study, many undergraduate students from biomedical science, and then also we have co-investigator Dr. Maestri from school medicine, and then our department chair, Dr. Nair, have been involved in the research. So the introduction of this research, as we all know, Alzheimer's disease is the leading cause of dementia, which affected over 60% of the patient. And then in addition, there's another chronic condition, type 2 diabetes, which is characterized by insulin resistant, high glucose level. And then the study have shown these two conditions share the similar molecular pathway, cultural value, and lifestyle in non-Hispanic population. The familism is one of the cultural values which considers migrate paradox play important role in the mental health in the Hispanic population. There's no study on those lifestyle, familism, and then genetics impact the cognitive reserve. Therefore, the aim of this study is to identify modifiable factors such as lifestyle, familism associated with Alzheimer's diseases, type 2 diabetes. So the material method, we start this project back to 2019. Again, many biomedical students involved. And then so far, we have recruited over 333 participants. We collected their lifestyle, we collected social demographic information, medical history, familism, cognitive assessment. And by the end, we also collect a saliva sample and then for the genetic study. In this particular study, we also screening two candidate genes which associate with cognitive function, ApoE, SEPT, and then TOM40. And we conduct data analysis using SAS and then SPSS. The results from those studies, and again, I'd like to emphasize there's 5 results. The first one, we observe high prevalence of the Alzheimer's diseases and cognitive impairment, which is 60%. We observe 32% comorbidity of AD, Alzheimer's diseases with type 2 diabetes. The second is we found association of ApoE with AD, but not associated with type 2 diabetes. And there's no association of SEPT and TOM40 genes with both conditions. And more important, we have observed a high-level familism negatively correlated to type 2 diabetes and cognitive impairment, which include both AD and then mild cognitive impairment. And this association remain even after adjusting for gender education using multi-logistic regression analysis. And number 4, type 2 diabetes was associated with low level of the physical activity, old age, low level of educations. And then, however, after adjustment, the significant association remained for only low level of the physical activity. And number 5, research finding is a shared risk factor include old age, a lower education level, and a reduced physical activity were observed among AD and then type 2 diabetes. As you see, the figure 1 is show the factor 2, because of Familism, we have 18 questions. We conducted a factor analysis, and then we observe factor 2 associated with both conditions. And then factor 4 is showing borderline associations with both conditions. And figure 1 is show the low-level education associated with cognitive decline. We also found the low-level of education level associated with diabetes. The discussion and conclusion, this study highlighted a high prevalence of cognitive decline and also a comorbidity of the cognitive decline with diabetes. And then the first research we have identified high level of familism as a protective factor linked with cognitive reserve and diabetes prevention. However, the sample size is small. We need increasing sample size as this study is ongoing study. We need to validate this finding based on large sample size. So I like to emphasize the undergraduate student from biomedical sciences. They are active, involved in the research, and then they play major role on this research finding. Thank you very much.